Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Eplerenone. Its brand name is Inspra. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Eplerenone. Then discuss examples of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. The first thing to discuss here would be the mechanism of action or how this medication works. So Eplerenone binds to the mineralocorticoid receptor and inhibits the binding of aldosterone, which is a component of the renin-angiotensin-aldosterone system. It increases the amount of plasma renin and serum aldosterone. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure, as well as in the treatment of heart failure from complications of a myocardial infarction or heart attack. With respect to contraindications or reasons we would not be able to prescribe Eplerenone, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Eplerenone or to any other component of the formulation. If a patient had serum potassium greater than 5.5 milliequivalents per liter at initiation, that would be a contraindication, as well as patients who had a creatinine clearance of 30 mils per min or less. Use with strong CYP3A4 inhibitors is also contraindicated. Now, these first contraindications are for all patients, but if a patient is using this medication to treat hypertension, there may be additional contraindications, or some of these contraindications may change, such as the creatinine clearance target. Now for some examples of dosing with Eplerenone. So in the treatment of hypertension or high blood pressure, the initial dose would be 50 milligrams orally once daily. You would allow 4 weeks to achieve optimum antihypertensive effect, and then you would have the option to increase to a maximum of 50 milligrams twice daily if needed. In the treatment of heart failure, again from a complication of a myocardial infarction or heart attack, the initial dose would be 25 milligrams orally once daily. You would titrate to 50 milligrams once daily, and then adjust therapy based on serum potassium levels. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Eplerenone, so we'll go over some of those here now. 3.5% of patients may experience hyperkalemia or high potassium levels. 2.5% of patients may experience a rise in their serum creatinine, and it should be noted here that patients using this medication there may be a decreased risk of experiencing gynecomastia or impotence when compared to spironolactone. Now, some more serious side effects would be angina pectoris, or chest pain, as well as myocardial infarction, or heart attack. Alright everybody, that's all we're going to talk about today with Eplerenone, or Inspra. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.